This video concerns itself with manipulating the unconvertible joints. These are developed joints. They develop in the first 10 years or so of life, so they're not there at birth, and they degenerate the same as any other joints do. They're also a bit different in as much as the articular surfaces of the joints are actually made out of disc material, so it's fibrocartilaginous rather than hyaline cartilage. So they're rough, and my view is that this basically predispose them to jamming up. And my experience is that you treat a lot more unconvertible joints than you do zygapophyseal joints. To the point where actually when I do make a decision that it's a facet joint, is I second guess myself every single time. And I look at it a couple of times just to make sure. Anyway, the unconvertible joints from the side of the neck, they run up and down, and with an approximated superior and inferior. Remembering, though, that the angle does change. So it's fairly vertical at the top, and it becomes more oblique as you go down. But don't worry about that. If you set this up properly, you'll apply vectors to it, and the result will be exactly the direction you need to manipulate, because the abnormal end field will produce the vectors, and then that will determine the resultant. So you'll always be in that. Don't aim it in any particular direction. The direction of the thrust you're making actually is inferior, straight down the side of the neck. But as I say, the resultant will determine an appropriate direction.
That one posteriorly, where we've lost right translation. So the way to take the superior vertebra posteriorly, one way of doing it is to take the inferior vertebra anterior. So we'll translate the superior vertebra over to the right, come underneath the inferior vertebra that way, stabilize on the left and thrust anterior on the right. So there and that. Okay.
The translational manipulation is certainly the easiest to understand of all of these. Basically, you find the translation that's lost and you manipulate it. If you found it in neutral extension, neutral flexion or extension, then you can manipulate it in neutral. Or, of course, you can also manipulate the other two positions. This would almost certainly be an unconvertible joint problem. If you're looking at it lost in flexion or extension, then it's probably a facet joint problem, and then you would manipulate it in flexion or extension, whichever one was lost. So with this technique, you simply note the lost translation, the position it's lost in, and you manipulate to restore that translation in that position. So there's almost no intellectual play going on here at all. Find it, you fix it, move on. My hands, though, this isn't a particularly successful technique. I'm not trying to project that onto you, but in my hands it doesn't work terribly well. So I prefer the other techniques, which are more complex, but with a little bit of effort, they become almost instinctual. So that's translation manipulation.
We can hit the translation rather than worrying about a particular joint. We can basically hit the translation. Let's assume we've lost left translation. We'll put them into flexion or extension, whichever one is appropriate. So if they've lost extension and left translation, we'll lift the superior vertebra into extension, translate it across while stabilizing the inferior one there, and then push across the neck against the worst end field. So it's basically lift into extension, translate.
Manipulating the unconvertible joints is not terribly difficult. For the most part, your preferred technique should be inferior and superior gliding. So if we look at it right side flexion, for example, then when I right side bend, the right unconvertible joint glides inferiorly, the left one glides superiorly. Right side bending can be restricted by either the right not descending or the left not ascending. Specific arthrokinematic tests on each joint will tell you which joint needs treating and which glide needs to be regained. The reason these should be your first treatment techniques is because it doesn't involve any rotation. And while the risk of these manipulations is low anyway, doing a non-rotational manipulation of the neck makes it even safer. The other two techniques we're going to look at are alternatives when these two fail. So these will be anterior and posterior. Now, We've talked about side bending and the movement of the unconvertible joint in that. If we rotate left and right, then you can see if I rotate left, my right unconvertible joint glides forward, my left one glides backwards. So either right or left rotation is going to be associated with inferior gliding. Now, which one it is, anterior or posterior, is up for grabs. Now, there's theories on it, or that's a bit of a grand word for this. There's speculations on the coupling of the neck. I think most people would agree in normal circumstances, the coupling is ipsilateral, but it really doesn't matter. You're not dealing in certain normal circumstances. Here, you have a dysfunctional joint, so the coupling could be anywhere. Ignore the theory, look at the practical. So when the inferior superior glide fails, then test that joint for anterior and posterior gliding, and whichever one it can't do, you manipulate it. So the first two techniques will be a superior and inferior glide, and the second techniques will be anterior or posterior gliding.
Right, so we're going to hit the right U joint. It's lost its inferior glide, which means the left translation has been lost, and we'll recover that by a direct inferior thrust. So stabilizing below, we'll translate across using the soft part again, in neutral or flexion preferably, but translate across. Take up the inferior slack, the down slack, but this time it's down the side of the neck. So translate across, take up the inferior slack and thrust down the neck. Again, translate across, take up the inferior slack and thrust down the neck. Okay. Right U joint has lost its superior glide, which means right translation is missing. So this will go onto the superior vertebra, and this one will go onto the inferior vertebra, and I'm going to thrust the inferior vertebra inferiorly to bring the superior vertebra superiorly. So translate across and thrust downwards. Translate and thrust. Okay, we're going to take the right one posteriorly where we've lost right translation. So the way to take the superior vertebra posteriorly, one way of doing it is to take the inferior vertebra anteriorly. So we'll translate the superior vertebra over to the right, come underneath the inferior vertebra that way, stabilize on the left and thrust anterior on the right. So there and flat. Okay. All right. The translation lost is to the right, which would have been superior glide. The manipulation for that didn't work, so what we will do now, we found that the anterior glide on the right side is restricted, and we've got to recover that. So this one will translate the superior vertebra to the right. This hand will come on the interior vertebra, the inferior vertebra there, and we'll push the inferior one posterior to bring the anterior one, the superior one anteriorly. So translate across onto the inferior vertebra and thrust backwards. Translate, thrust back. Okay, we're going to take the right one posteriorly where we've lost right translation. So the way to take the superior vertebra posteriorly, one way of doing it is to take the inferior vertebra anteriorly. So we'll translate the superior vertebra over to the right, come underneath the inferior vertebra that way, stabilize on the left and thrust anterior on the right. So there and flat. Okay. Posterior glide now on the right side where we're missing the left translation. So again, stabilizing below, we will translate the superior vertebra across to the left there, take up the posterior slack and thrust inferiorly, posteriorly rather. So stabilize, translate, take up the belt slack, thrust posteriorly. There. All right, unconvertible joint. If the inferior glide had failed and we found that the anterior glide was restricted on that side, we'll change the techniques and we'll now try to regain the anterior glide on the right side where we're missing left translation. So stabilizing below, we'll translate the superior vertebra to the left, come down under it this way and basically thrust anterior. Translate, drop your body down, take up the anterior slack and thrust anteriorly. Okay. posterior glide now on the right side where we're missing the left translation. So, again, stabilising below, we will translate the superior vertebra across to the left, there, take up the posterior slack and thrust inferiorly, posteriorly rather. So stabilise, translate, take up the slack, thrust posteriorly. There.